My name is Tamas Fülöp. I am a medical doctor, and I am a professor of medicine and geriatrics at the University of Sherbrooke in Sherbrooke, Quebec, Canada. So I am in research since a long time. I made my medical school in Geneva, and I met at this time Professor Junot, who was a famous geriatrician. So from the whole group, I was the only one who followed his seminars. And, he contaminated me, so I became a geriatrician. So I look after patients and in the outpatient and inpatient setting. And I created the memory clinic in Sherbrooke and also the oncogeriatric clinic in Sherbrooke. So I am working in these two specialized clinics. And also, I met several people during my lifetime, and my research career is on immunology and aging. So we started with the innate immunity, we continued by the adaptive immunity and immunosenescence, inflammaging, and the role of immunity and chronic inflammation in several age-related diseases like cancer, neurodegenerative diseases, and cardiovascular diseases. So this is my main field of professional life and research career. But I have been involved in some clinical trials on Alzheimer disease, on hypertension and hyperlipidemia in older subjects, but mainly in Alzheimer clinical trials. Oh, yes, I am a member of many medical and scientific societies. I have been the president of the Quebec Geriatric Society for 7 years. I served on the publication committee and the executive committee of the biological section of the Gerontological Society of America. I am the fellow of the GSA. I am at the American Geriatric Society, the Society of Leukocyte Biology, the American Society for Immunology, and many others. So, and different roles that I have. And also I have been in the International Association of Gerontology and Geriatrics, and I have been on the executive committee for 12 years. And I was the treasurer, vice president, so many international, and I have been also the president of the International Association of French-speaking Gerontological and Geriatric Society. So I have been involved in many societies, either clinicians or geriatrics or scientific. I think they are very important because it gave me the possibility to collaborate, to know many people, collaborate with them, and also the network that they can create. And also, this is very important to disseminate our works by these societies, because most of them are organizing special congresses. And these congresses are very important for meeting, for discussing, and also they have journals which are related to the subjects that you are doing. So I think these societies are very important and very helpful if you want to move out from your just local setting and being more international. I was approached by many journals, and I created many journals during my life, and because of many special, how can I say, requirements of other journals, I always resigned as editor-in-chief because they were all meant on financial interest. I can tell you these new, I want to tell them the name of these. So this was one of the reasons why I couldn't work with others. And what I mean was in Karger, that their main objective was not money, but science. And this was for me very important. Actually, I got a very, very strong help from the Karger editorial office, mainly from Jamie Steer. And he is really somebody who is very comprehensive, very helpful. And also we had some problems with plagiarism. They were really there and solved the problems. And really my relationship with the person who is responsible of gerontology is also very, very, very good, very professional, very scientific, and really very nice. And I think with Karger, this is an extraordinary experience because they never tried to influence me for anything, but they were always helpful. And I think their main vision is the honesty in science, and this is really very important for me.